We believe that there is a lot that needs to be done in this country to ensure that we bring mental health to the same level, to this level that we feel that also suffer from the mental health disorders are able to enjoy the same quality of service and quality of health of the highest standard. That is what is enshrined in our constitution. That is also what is in our health policy, and again, that is also what is in our mental health policy. Just to say that Kenya is one of the top 5 countries to have the mental health policy being put in place, recognizing the high burden of mental health that this country and many other African countries are going through. Mental health problems or illnesses or disorders, they actually have one of the highest burden, even more than HIV/AIDS, even more than other communicable diseases like malaria. And the reason why we have come up with now the mental health policy, we're soon going to come up with strategies, with programs, going now to address the various areas within the mental health services. As much as we are doing to ensure that the environment is conducive, as much as we are doing to ensure that we have the adequate human resources and that we have the necessary equipment, this is not good enough. Mathare is just centralized. We would want to decentralize the services that are being provided, and we're going to ensure that what used to be the regional there used to be regional mental rehabilitation centers that used to be there. All right, at least these ones are strengthened. We have adequate capacity to ensure that services that would have been provided at Mathare Mental Health Hospital can actually be provided anywhere else in Central Region, can be provided elsewhere in the Coastal Region, Eastern Region, and even in the Lake Basin Region.
Psychological first aid is an initial, humane, and supportive initiative taken on people when they are going through a crisis event. And how to go about it, there are about 4 or 5 steps. The first one is the preparedness. The second step is doing your assessment. You need to do the assessment to know that there is enough security, they know the resources which are available. The next step is to give empathetic, psychosocial support to these people, provide them with the information, connect them with their loved one, make sure they feel that there is someone who is there for them. Then the next step, you're able to link them to the necessary services they require, physical services, they need to be connected to their loved one, they need to be taken to the hospital, and then there's a follow-up care after doing the psychological first aid. Most of the health workers, it's mandatory to have the skills in physical first aid, and they are able to provide basic life support, they are able to provide advanced life support. And most of the hospitals, it's a mandatory requirement that they have this. So we need to move to a step where we should have every other health worker is having these skills as part of their training.
And in other words, these are skills that we are going to combine even with other trainings. We are training somebody on malaria, on TB, or whatever. This is a component that we're going to introduce to ensure that we reach more of our health workers, right? The issues of the cards and all those things, these are things we're going to ensure wherever people are accessing care, this information is available for them to ensure at least they are able to read.